Well, welcome back to Harmonize Your Life Conversations on Self-Care for Women of Color podcast with your host, Dr. Tony G. Alvarado. I am so excited to welcome you back to the 14th season. Yes, season 14 of our podcast begins with this month, October 2024. It's hard to believe that we have been doing this podcast since 2020. 4 years now, we've been having these conversations around self-care, health, wellness, fitness, every aspect of what it means to have a harmonious and healthy lifestyle. We have had conversations with doctors, nurses, physicians of all kind. We have had conversations with physical health professionals, with nutritionists, mental health professionals, accountants, and just your regular everyday girl who is serious about her own self-care and the self-care of and the health of our community. And so this month, like every other month, is going to be a wonderful time of inspiration, information, and for us to grow and learn together. Of course, the month of October is always dedicated to breast cancer awareness and domestic violence awareness in our society, and so we always tailor our conversations in the month of October around those themes. And so this month we'll kick it off with a conversation on breast health and self-care, and I have a dynamic professional breast surgical oncologist who's going to be with us today to help us and guide us through this conversation. So we'll be right back with our guest, our first guest for the month of October, right after this. Well, I want to introduce a new voice to the Harmonize Your Life podcast, and that is in the person of Dr. Rylan Gore. I am going to just share with you who she is, a little bit about who she is. Dr. Rylan Gore is a breast surgical oncologist, and she has just opened a wonderful facility right here in Atlanta, in the Buckhead area, the Dream Breast Center, which is a luxury breast care haven offering top-notch services to patients with compassion, expertise, and attention to detail. At the Dream Breast Care Center, they believe in that while a new breast center diagnosis or other breast concern is often a surprise, unpredictable, and stressful experience, that the healthcare experience does not have to be so. Their mission at the Dream Breast Care Center is to provide exceptional and compassionate breast care rooted in health equity, with the overall goal of improving the health, quality, and of life and well-being of their patients. Their guiding principles are excellence, knowledge, integrity, and compassion. And with these values, it guides every aspect of the care that they provide. It's founded by Dr. Rylan Gore in 2023 and opened in 2024. Dream Breast Care Center is truly a dream come true. As one of the few Black female breast surgeons in Atlanta, Dr. Gore brings extensive training, experience, passion, and dedication to the medical landscape in Atlanta. She was born this center, the Dream Breast Center, was born from the simple but revolutionary idea that every single patient deserves access to quality surgical care, regardless of their creed or color. Every single detail has been carefully planned and hand selected by Dr. Gore so that women navigate their diagnosis in a posh practice with support, strength, and a profound sense of peace. I want us to meet and welcome Dr. Ryland Gore to the Harmonize Your Life podcast on today. Welcome, Dr. Gore.
Thank you. Thank you for having me. I truly appreciate it. Thank you so much.
I am so excited to have you with us on today. I know we have a mutual friend and colleague in my sister, Dr. Deanne Johnson, who I believe that's your auntie.
She is like an auntie. When I tell you, so my family, I don't know if you remember my mom, Sonia Gore. She was the minister of music for a very long time.
Yes.
Wow, you don't remember me. I remember you. I remember, when they first started the church, we were one of the first members.
Yes, I remember.
And I remember, even if you
your
don't
mom
remember,
played the keys.
Yes, even if you don't
remember. Now I see the resemblance. I see the resemblance now.
So I told my mom what I was doing today, and I'm like, well, even if she doesn't remember me, I remember being a little girl.
Oh Lord Jesus! Wait a minute, now you're making me feel old.
I remember when y'all were off Covington Highway.
Yeah.
Yep, back where the Target. It used to be a Hardee's. All this stuff.
Yes. We've been pastoring in this city for 32 years now. And so for you to say you remember me when you was a little girl, oh Lord Jesus. And now you look at you, a full-grown woman, a breast surgeon, an oncologist, breast surgeon, opening your own breast care center. I'm so excited and proud of you.
I know she's Dr. D, Pastor D to everybody else, but to me, she's Aunt D. She's literally known me my whole life.
And she is a beloved sister.
Absolutely.
And beloved friend. And I know she is going to be tickled pink when she sees you on the podcast. Okay? I know. Well, listen, Dr. Ryland Gore, talk to us about who or what inspired you to focus on breast health in your medical practice.
So I don't know. If you ask Aunt D, she'll tell you. I was running around church 7 years old talking about I'm going to be a doctor. And I honestly thought I always knew I would do something with women's health, right? Like I actually thought I was going to be an OB-GYN. And for a long time, I said I was going to be an OB-GYN. And that kind of guided my path. Mm-hmm. And after college, went to grad school, got my master's in public health. And my concentration was actually maternal and child health. So I was really honed in on the fact like, oh, I'm gonna change the world. I'm gonna be an OB-GYN and take care of the community, maternal health, maternal morbidity. We hear a lot about that now when it comes to Black women.
Yes.
And I got to medical school. I was right up the road. I've lived everywhere, but I went to Morehouse School of Medicine. I came home.
Where many of our Black doctors graduated from.
And get through the first 2 years, fine, whatever. That's in the classroom. I got to that third year, did the surgery rotation first because I was like, man, this is going to suck. Like, let me get this over with. Loved it, fell in love, decided on day one. I'm a very... anybody that knows me they'll tell you I'm a very decisive. Once I make up my mind about something, I'm extremely decisive. And I decided on day one of my first rotation, this is where it's at. I'm going to be a surgeon. And they were like, oh my God, like get through your other rotations. Got to OB-GYN, absolutely hated it. And so I was like, well, there it is. That's what I'm doing. And not until residency, my general surgery residency, which I did in Chicago, did I realize that I could still do women's health. And be a surgeon. And loved my breast. Every time I had a breast rotation, absolutely thrived. General surgery residency is extremely hard. So it was between that and becoming a transplant surgeon. But I love breast, and I love taking care of women. And as I know now, and just going through the process and taking care of people and learning more, that breast cancer disparities are extremely real. Surgical disparities are very real. Health disparities are very real. And so the fact that I'm able to educate people, educate other physicians, educate regular people, and talk about this in many different venues, including on stuff like this, a podcast, or whether it's a conference stage, it's been amazing and extremely impactful. So that's kind of took kind of the winding road to figure out that I could do women's health as a surgeon, but it's extremely fulfilling.
That's, that when you say you took the winding road, sometimes, we think that the line to our purpose and destiny is a straight line, but often it's not. I often tell people that the course to your destiny is a winding road. It's a left and right and then up and down, maybe push back a little bit and figure it out. Believe it or not, I went to school for nursing my first time around, and then got to the clinicals after 4 years, got to the clinicals and was like, oh my God, I can't do this. You really be a nurse if you're scared of, listen, you can't be a nurse if you're scared of blood and needles and dead people.
Right.
I was like, no, this is not for me.
Right.
But what's interesting is how I've come full circle, because my mom was a nurse. And so I've always been interested in helping people, which is why I'm a pastor, right? My main work, and then being a coach. But now one of my passions, of course, is fitness, health, and wellness. And so now I get to marry my love for my pastoral work, my clergy work, with helping people, because I believe the scripture teaches us that we should be whole, spirit, soul, and body, right? So I believe in a holistic approach to ministry and living. And so to be able to marry my passion for health and wellness with my theological and biblical work is something. So when I went to, I'm also a coach. So when I did my certification for health and wellness coaching, I told my mom, I said, I feel like I'm back in nursing school. Good, because some of it wasn't new to me because of my 4 years in nursing school. So I applaud you for taking the circuitous route and finding your purpose and your destiny. It was always there. I mean,
absolutely. I've always been very, let's be clear. I've always been very clear about what I was going to do. And, people, they ask, how was it? How was it? How was it? And I got to say, specifically in residency, that was very hard for me. And up until that point, I feel like because I was always very smart, right? A lot of things came easy. And so residency onward, I would say that a lot of it has truly been a faith walk. And people ask, well, how is residency? How is this? Especially people not in the medical field. And I tell people it's a series of peaks and valleys, and that the days are long, but the years are very short. And the last couple of years have been a true faith walk regarding having to pivot in my career and what work looks like and what working for someone versus not looks like, and trusting God, trusting his promises, trusting, who he called me to be, and trusting that he knows what he's doing, even when I can't see it. So there have been dark days, like a lot of dark moments, but, I find it really interesting. My middle name, I always go by my middle initial, but my middle name is Joy. And God knew during certain points that I would need that. And so even when, I left my job, left the hospital I was working for, and didn't work for a long stretch, almost about a year. And I'm like, he knew what he was doing when he named me, right? Because he knew that I would need that and knew that I would need to draw on that. And so, not to get off topic, because I know we're supposed to be talking about breast cancer, but for those that are listening, just
actually that connects to what we're talking about.
Stand on the promises of God, and go to your word and remember who you are, but I'll remember who he is, and
And honestly, I think that
let me stop before I cry, because when I really think about, I don't miss whether it's a patient or somebody else, I don't miss an opportunity to talk about the goodness of God. And I'm not afraid to say that, because when you've been through some stuff and you're like, this is not what I thought my life would look like, and you get plucked out of it miraculously, there's no way that it was because of you. And it doesn't matter that I'm a surgeon. It doesn't matter. Life doesn't care. Okay. So you gotta make a decision about what you believe and who you believe in. And so, not to get off topic, but
no, honestly, Dr. Gore, that really does relate to what we're talking about. because you said life happens and it happens to all of us. And how many women have gone
breast cancer, it happens.
right?
Yeah, I know.
Even when we've done the best of taking care of ourselves, it
Yeah,
happens.
absolutely.
It can happen. I mean, I've had a couple of scares, thanks be to God. Nothing has manifested, but there have been times I'm like, oh, wait, what is this? You know what I'm saying? I remember one time I went and they had to do they had to call me back to do a what you call it, an ultrasound.
Ultrasound.
And
Yeah.
I mean, and the thoughts that come through that run through your mind and all of that, and being supporting other women. As a pastor, I've walked with women. Some of them are now have passed on. Some are still, celebrating their healing. Right. My sister, one of my sisters, is a breast cancer survivor, and so what you're talking about really relates to the topic, right? Because I can only imagine that if getting a diagnosis of breast cancer can be so scary and can leave us in a place of wandering and not trusting God and needing joy, right?
Yeah.
And so that is so, and along those lines, on those days where you've been challenged concerning your joy or your journey, has there been any particular story or woman that you've treated that kind of has inspired you to keep going?
I think all of the patients in their own way, every time they make it through a step, just the happiness, right? It's like, I'm like, we're going to take this one step at a time. We're going to do this, and don't don't think about all the extra stuff. Like, you can only do what you can do today. And so, um, I would say that all of my patients are inspiring,
Okay.
even the ones that have succumbed to the disease, because I got to say, all these women, they are fighters. I
Mhm.
mean, even when they're circling the drain, unfortunately, they go down fighting. And but I do also feel very blessed, having during residency and throughout my career, my very I still have a lot of career in front of me, but
Okay.
so far, um, so many cancers are just the prognosis just isn't as good. And so I also consider it a blessing to deal with the cancer where there's a ton of research out there, new drugs, new treatments, new things every day to prolong women's lives. Um, that's one thing that's amazing to me. And so I can truly say, even when I do have a woman walk through the door and she has advanced disease, more than likely, she's going to do well. I would say 97% of my patients are going to do very well. And I know that next year and the year after that, I'm going to see them. And after we get through the business part of the meeting, like, okay, let's look at you, let's examine you, let's look at the imaging, let's do this. I know that we're going to start the social part of the visit. Like, how are the kids? Did you go on vacation? How are the grandkids? And so it's encouraging to deal with the disease where most patients do well, because with so many cancers, you can't say that, right?
Mhm.
Pancreatic cancer, brain cancer, some of these advanced abdominal cancers like colon cancers, you can't say that. And
Mhm.
childhood cancers, like so many, you talk about cancer all day, every day. And so
Mhm.
it's
Mhm.
heavy for me too. And, you got to find a way to leave it at the front door. You have to find a way to encourage yourself, or, gird yourself spiritually. So, dealing with a disease process where I know the majority of my patients are going to end up on the other side and continue to
Mhm.
live their lives.
Mhm.
That
Mhm.
that's one thing I love.
Mhm. So you talked about 95%, and one of the things you said was, well, two things you said. You said 95% of your patients are going to do well, and you talked about the fact that breast cancer is one of those cancers that is more curable maybe than some of the other cancers that are out there, and you're blessed to be able to work with a cancer that where there's more hope.
Yeah.
Right? Because it's so funny. One of my ministers at the church a few weeks ago, his mom was diagnosed with I think stage 1 or 2, something like that, of breast cancer. And when he just, just hearing the word cancer strikes fear in our heart, right? And he came to me, he was like, oh Lord, my mom. And I said to him, I said, she's gonna be okay. And I said, it's just not the death sentence that it used to be.
Mhm.
And I talked about much of the research and the advancement that we've had concerning this disease. But so that was one of the things that was very hopeful. And to hear you say that 95% of your clients or your patients will do well. What are some of the common, can you just share? And for those that may not know, what are some of the common symptoms or things that we should be looking for or checking for as women? And particularly, talk to us about how it's staged, in that process.
So most women, it's caught early, and most women do well because most women are going to get their mammograms. Number one, it's important to note, and because there's a lot of information about out there from organizations we trust about how often you should do it and when you should start. So out the gate, let's just get this out the way. Women should start their screening mammograms at 40 years of age. This should happen every single year. The number of cancers I've seen develop in between normal mammograms is kind of impressive. And so there are some organizations that'll say you can get it done every other year. Not good enough. The organizations that most oncologists, whether it's medical oncologists, surgical oncologists, whatever, the organizations we trust, the guideline is every single year, get your
Every year.
screening mammogram. This is for
Get your tatas checked every year, ladies.
And I can talk all day about some of the research out there and the push for Black women to start earlier.
Okay. Can you talk about that, please?
Yeah.
This podcast is dedicated to women of color. So yeah, talk about that.
The data shows that Black women are more likely to be diagnosed with more advanced disease and more likely to be diagnosed with more aggressive disease, for example, triple negative breast cancer, and more likely to be diagnosed before the age of 40. I can personally tell you that the youngest patient that I diagnosed, who was a Black woman, was 19. And so there is a push amongst oncologists and some of our organizations that being Black itself is high risk, right? And so maybe we need to push for our Black women, our Hispanic women, to actually start their screening mammograms at the age of 35 instead of 40 because of the fact that we are more likely to be diagnosed before the age of 40. Now, I realize, not every physician or healthcare provider is an advocate.
That's what I was going to ask you. What do we do with our healthcare?
You advocate for yourself. Listen, I'm gonna get to that, but you can advocate for yourself. Realizing not every physician or healthcare provider knows that. If you're not, in the cancer world, you don't know that, especially if you're a primary care physician and you're dealing with all kind of stuff all day, every day, and patients are coming in and each one of them has 20 issues, right? And also the big issue comes with insurance coverage and whether they will cover it.
Right.
And so there are ways, to circle around it. And I've been pretty successful with getting it done for my patients. But the American College of Radiology and the Society of Breast Imaging, they do have a statement that says that this should be strongly considered for Black women and other women of color because of them being more likely to be diagnosed before the age of 40. So number one, screening mammograms at the very least start at 40, get it done every year. Most women will say, so when do I stop? And some organizations have a cutoff of 74 or 75. I know some 75-year-olds who are they're better than some of my 30-year-old patients. Like, they are so vibrant. And so my rule is the traditional teaching was, if your projected lifespan is now less than 10 years left, don't do it. My colleagues and I, this is my belief. If you were to get breast imaging or any imaging for that matter, and something bad comes back on that report, and you say, well, it doesn't matter, I'm not going to do anything about it, then stop your imaging. But if you were to get a mammogram done today and something bad came back and you're like, I want to do what it takes to take
Mm-hmm.
care of this and nip this in the bud, I have other things to do, then continue your imaging until you feel
Okay.
like if a negative report came back, no, when I say negative, I mean bad. If a bad report comes back, you wouldn't do anything, then at that point you need to stop because there's no need in wasting resources,
I
right?
understand. I understand. I get you. And so, and I agree with you. I mean, we're living longer because of medical science and things like that. And many of us are doing better about taking care of ourselves. I mean, I honestly feel, you said that when you said that you remember me when you was a little girl, I was like, oh wow. Okay. So, but I'm
I'm
61.
sorry.
No,
I didn't mean it. I
but
take it back.
but Dr. Ryland, I'm 61 and I can honestly tell you that I feel more vibrant at 61 than I did when you remember me as a little girl.
Mhm.
You know what I'm saying? Because I wasn't as back then, 30 years ago, I was not as conscious about my health as
Mhm.
I am today, right? And so now, with me being more intentional about my fitness routines, my self care, my health, getting rest, taking breaks, all those things, I literally feel healthier, more vibrant, more
Mhm.
stable, you know, all the way around harmonious. Better than I did at 31, right?
Mhm.
And so you're right. So some of us in our 70s living are very vibrant, and so I agree with you. So let me ask you this: so,
Mhm.
what are some of the reasons for Black women having maybe earlier
We
incidents?
don't we don't know. We don't know. And that's unfortunate. I think when we get to an answer for that and when research uncovers it, we'll be able to pin that down. But that's why I'm a big fan of self-awareness and self-exams. Again, I'm not going to
Mhm.
call names, but there are some organizations who say that there's no utility in women doing their own breast self-examinations. But I have quite a few women, and I would say up to half of my patients who come in and they have a new breast cancer diagnosis, they found it themselves.
Mhm.
Like they felt something or saw that something was off, and if it wasn't them, it was a husband or significant other that noticed that something was off. And so I think it's important to know what they are yours. And I tell women all the time, they are yours. Touch them and know what they feel like. And
Look
there
at yourself in the mirror, right? And you're right.
there is nothing, and it's important to say this because there's this idea, this very puritanical idea that there is something perverted about that. And there is nothing perverted about knowing your body so that you can make informed decisions.
Say that again. There's
And
nothing perverted about knowing your body.
please,
I love that.
I've had women come in with some of the most horrific cancers. And I'm like, didn't you notice? Didn't you? I think there's a combination. I think it reaches a point where maybe you don't know because you don't do your examinations. But then it reaches a point when I see a huge tumor that now we've ventured into delusion and self denial, right? Let's not do that. Okay. And so at some point, you're going to notice a big mass sitting on your chest. So don't lie to yourself and don't lie to me. But I do have women that come in with masses that I can feel. And I'm like, you didn't feel this? Sometimes I can see it before I've even touched the patient. And some people, they think it's dirty. They think that, it's your body and, it's a temple and it's our job. It's the only one we get while we're here. And so it's our jobs to take care of it. And so doing your self examinations is not dirty. And I just feel like I have to say that because there are people that believe that or believe that they're sinning or doing something wrong if they know what their own body feels like. And I think it's important. And we need to teach our girls too. You need to know what it feels like so
Mhm.
that when something abnormal pops up, you can go to your primary care physician or OB-GYN or whoever that is, that point of care for you, and say, you know what, this is normally what's going on, but I've noticed XYZ. And so that leads me into what does breast cancer look like on a physical examination? So, first of all, most breast cancer diagnoses, you won't feel anything. And this is why we push for mammograms. Mammograms can identify breast cancers up to 2 years before you can feel it. And so this is really important because the earlier we catch it, the better your chances of survival and preventing the breast cancer returning in the future. So that's number one. But number two, if you feel any masses or lumps, if you notice any skin changes, redness of the skin, swelling of the breast, now all of a sudden one breast is much smaller or much larger than the other, all of these are red flags. Any nipple changes, nipple inversion, nipple discharge, bloody nipple discharge, especially if it's only from one side. And this excludes the women who are postpartum and breastfeeding. Nipple discharge is normal. But if you're not breastfeeding and all of a sudden you have nipple discharge, red flag, and it needs to be evaluated. Also, things that look like infection, like, oh, I think I got bit by a bug, or oh, somebody's telling you, your doctor or somebody's like, you have mastitis. And I'll have old women come in with that diagnosis. You have no reason to have mastitis. You weren't outside in the woods frolicking. You're not breastfeeding, and so the nipple pores aren't open where bacteria you can get in. And so these are things to be mindful of. Any new ripples or dimples, all of these are red flags and things to be mindful of. And so also realize if you feel something or have any symptoms, this is not a screening mammogram anymore.
Okay.
This is a diagnostic, meaning instead of just going in before work, get your mammogram in and out with a diagnostic, meaning there are symptoms that need to be worked up. It's a diagnostic. That means the radiologist is going to review those images at that moment. If they think they need additional pictures, they're going to keep you there and keep doing pictures until they're satisfied. If they think that you need an ultrasound, they're going to also do that at the same time. If they think you need a biopsy, they're going to schedule it before you even leave. And so screening mammograms are for no symptoms, no issues. We're just doing a checkup, making sure everything is cool. Diagnostic is there are symptoms, there are concerns.
Okay. Okay. Well, I want to ask you. I want to ask you one other thing about just in terms of the care. What when if I was to get diagnosed with breast cancer and I came to your center? By the way, tell us about your center real quick. Tell us about your center because you just opened a breast care center.
I just opened, and so there will be ultrasound, the ability to do biopsies there. No mammogram. We don't have it set up. You have to have special walls and to block the X-ray beams from spreading. You don't want to expose people to unnecessary X-rays. And so we do not do mammograms in the office. I am a breast surgeon, so I'm usually the first stop for patients with a new diagnosis or a patient with a new complaint, and it needs to be worked up because there's a concern. And let's be clear, yes, I take care of breast cancer patients, but there are plenty of other breast issues that do require surgery. Okay. And so I take care of that too. And so I'm usually the first stop. If you need to be referred to other physicians, especially after we do surgery, I'm the one that handles that. Okay. I'm the one that makes sure, especially after surgery, you're getting your imaging regularly. You're staying up on everything. You're taking whatever medication you need to take. So I'm kind of the quarterback of the team. And so it's a lovely practice in the heart of Buckhead. It's off of East Paces, which is a quiet street. And so I know Buckhead can get real stressful. It stresses me out, and I have, all my reflexes are intact. But when I'm on Peachtree, sometimes it's just too much. This is in the heart of Buckhead, but
overload.
It's overload. It's too much. But off of Paces, quiet building, very easy to navigate, and just lovely staff and just a welcoming environment so that women feel, and men, let's be very clear. I have male patients as well who do have breast cancer or are at high risk for developing breast cancer. So it's not just for the ladies, everyone is welcome. But yeah, I'm the one that does the surgery for your breast needs.
Wow. Can you talk to us about the importance? Two other things I want you to touch on. One is what type of mental health support does a woman dealing with breast cancer need? And I don't know if that's, do you have partnership with anyone along those lines?
Yeah. So there are several, I'm a big fan of support groups.
Okay.
And so I know for a fact that Northside has several support groups. American Cancer Society, who I do work with, they have support groups, and so does Komen. There's also Gilda's Club. And then, I know people that have different religion-based um,
Mm-hmm.
support groups. I will say that I would say half and half when it comes to patients who decide to do a support group or not, because sometimes it can be overwhelming and you're trying to keep a positive attitude and you're like sitting in a circle with a bunch of people complaining about, what's going on. And sometimes that can be depressing. And so I do find, and studies have also shown that people who are going through cancer, not just breast, who have a strong, even if they're not religious, but have a strong spiritual foundation, those patients do better than
Mm-hmm.
those that don't. And so just something that people should keep in mind, that if you are religious, like hold on to your faith. I swear. Like it will help. It really, really will. And I find that patients that have support, whether it's, and that's not always family, you'll be surprised. You'll be surprised who will support you and who will look out for you. I've had patients say that some of the most unlikely people who they did not think would step up for them did, whether it was a next door neighbor or a coworker. And so your journey, a patient's journey is theirs to tell. And so you have to be comfortable with sharing, and some people don't want to share. But if you don't have a strong family network, or at least one or two people that you can call to help with certain things, whether it's meals or getting back and forth to chemotherapy or getting back and forth to radiation, try to curate not just your medical team, because when it comes to your medical team, these are people you are going to be seeing often for a long time. And so these are people you need to be comfortable with. And so I do tell patients, if you're not comfortable, seek a second opinion when it comes to your team.
Mm-hmm.
Up, bring a buddy to those appointments, whatever, do what you have to do so that you feel comfortable in that space. But also when it comes to your home life and just getting through the nitty gritty of every day,
Mm-hmm.
curate that support team also.
That's that harmony. Yeah. Mm-hmm.
And we take it for granted, but not everybody has that. And I do have, a handful of patients who are going through it, and it's just them, and they're very strong. But why should we shouldn't have to be strong all the time.
No.
So curate your medical, I tell everybody, curate your medical team and curate what your support crew looks like.
Mm-hmm. Yeah, that's good. That's good. I'm gonna do a little station identification, and I want to go back to your dream breast care center so I can just tell people where to find you, and then I'll have you close us out with some final words. But for those that are just joining us, or maybe just listening, you are listening to or watching on YouTube the Harmonize Your Life Conversations on Self-Care for Women of Color podcast with your host, Dr. Tony G. Alvarado. I want you to know where you can find us. You can find this podcast on YouTube. Let me put that on the screen. You can find us on YouTube. You can find us on Spotify. You can find us, let's see here. You can find us on YouTube at Dr. Tony G. Alvarado. You can find us on Spotify. I also want you to go to my website at drtonyalvarado.com. You can join there, the Harmonize Your Life Women's Self-Care Network. Become a part of the network. Go to the website, drtonyalvarado.com. You heard Dr. Ryland talk about being a part of a network, being a part of a support group, or having a foundation, a spiritual foundation. If you join the Harmonize Your Life Women's Self-Care Network, we have many women in our network who are, several women in our network who are breast cancer survivors, and we celebrate with one another. We support one another. And overall, we help one another with health, wellness, self-care, fitness, what I call SEA, support, encouragement, and accountability. So I want you to know that you can do that when you join the Harmonize Your Life Women's Self-Care Network. Today, we've been talking with Dr. Ryland Gore about self-care and breast health. And I want you to know where you can find her. She is the founder, establishmentarian of the Dream Breast Care Center in Atlanta, Georgia. You can go to her website at dreambreastcare.com, www.dreambreastcare.com, and look her up, follow her on Facebook, go to her website, and listen, either you or if you're concerned, reach out to her. Even if you need to kind of, she can maybe point you, if you're not in the Atlanta area, maybe she can point you to somebody in your city. We recognize that some of the women that are listening are not in the Atlanta area, but listen, look her up, check her out, check out the services that she provides at the Dream Breast Care Center. Go in and check it out. All right. Certainly, if you're a woman and you are concerned and you have some issues, please reach out. Don't be in isolation. Do not sit home alone. Reach out to someone. And Dr. Gore is certainly someone in our community that you can reach out to. Dr. Gore, will you just give us one last word of encouragement as we prepare to sign off?
Yes, I always sign off by saying, if you feel something, say something. And that goes for everyone. That goes for my ladies and my men too. I always tell patients to curate, like I just mentioned, curate your team and curate your medical team as well, so that you get the best experience and you feel like you're getting what you need out of your healthcare experience. And also, if you're going through this, I just want to say, keep your faith and stay strong, because there really is joy in the morning. Weeping endures for a night, but joy comes in the morning. And this is so manageable. And there are so many treatments out there to get patients on the other side of a breast cancer diagnosis. So keep your head up, keep looking up, and keep your eyes looking up to God.
Wow. Thank you again so much. You're such a, just your aura is here. Just your whole personality. I'm telling you, that I'm sure that calms your patients down. I'm gonna tell you this.
Say that. I won't lie. They're like, "Oh my God, you're so calm. Like, I can't help but be calm."
I'm gonna tell you now. I'm not looking to have breast cancer, but I tell you what, if something show up, if I think something showing up, I'm calling you.
I would love to take care of you, and I would consider it an honor. And I say that to everyone who's listening to this as well. I love what I do, and I consider it such a blessing and a calling, more importantly. And so, if you need me, I hope you don't need me, but if you need me, I'm here, and I would consider it an honor to take care of you.
Well, I'm telling you, if I need you, I'm calling. And you know what else? Any other girls that I run into, I'm gonna be
tell them to come on.
I know just where you need to go. You know, I'm a pastor too, so they gonna come to me for prayer. But I'm gonna send them to you for treatment. Okay. Yes. All right. Thank you. It is so good to be able to partner with you in educating our community. You know, the Bible says we perish for the lack of knowledge.
Yes.
And I often add, we perish for the lack of knowledge and action. Right. Mm-hmm. So that's not just know, but let's do. Let's do what we need to do. Let's do our breast exams. Let's examine ourselves. You said it. It's self-awareness. And I always say self-care begins with self-awareness. So I love so many things that you said. And I know that the women and men that are listening to this podcast are going to be blessed. Thank you so much, Dr. Rodney.
My pleasure. What an honor. Thank you.
What an honor to have you. God bless you and God bless your work.
Thank you.
All right, everybody. Thank you for joining in for our first episode in the month of October on the Harmonize Your Life Conversations on Self-Care for Women of Color podcast with your host, Dr. Tony G. Alvarado. We'll see you soon.